Welcome to the channel. Don't forget to like, subscribe, and press the bell icon to stay updated with every new story. These filthy hands don't belong in my examination room, doctor. Westfield's face contorts with disgust. He shoves the black man's shoulder violently, ripping off the blood pressure cuff. Pick up your chart. Dr. Westfield kicks the folder off the table. Papers scatter across the floor. Downtown clinics handle your kind, not me. The black man leaves without a word, but his fingers already dance across his phone, setting something irreversible in motion. Michael Davis strides into Lakeview Medical Center at precisely 10 a.m. His tailored charcoal suit speaks of wealth and position. At the reception desk, Michael presents his premium insurance card. The receptionist's eyes flick between his black face and the gold level coverage notification on her screen. In his office, Dr. Edward Westfield reviews his patient list. His expression sour when he spots Michael's name. He emerges briefly, surveying the waiting room. His gaze lands on Michael, and his smile vanishes instantly. "Rebecca," he whispers urgently to the receptionist. "Why is he in my schedule? Corporate referral, premium coverage." Dr. Westfield's lips press into a thin line. Minutes past his appointment time, Michael sits patiently. Every other patient receives water, magazines, friendly conversation. He receives sideways glances. Dr. Westfield barely looks up when Michael enters. "How exactly did you get referred to this practice, Mr. Davis?" "My company's executive health plan. I have premium coverage," Michael explains. Dr. Westfield's jaw tightens. "We'll see about that." "I've been experiencing persistent headaches and unusual fatigue," Michael explains. "They've been worsening over the past month." Dr. Westfield barely glances up. "Probably just stress. Take some ibuprofen and get more sleep. The headaches wake me at night, different from any I've had before. Everyone thinks their symptoms are unique." Dr. Westfield sighed, theatrically. "It's rarely the case. I'd like a complete workup, please." Dr. Westfield laughs dismissively. "Not necessary. Overtesting drives up healthcare costs. With all due respect, doctor, I know my body. These symptoms are new and concerning." Dr. Westfield's face hardens. "I'm the medical professional here, not you. Then go back to your previous doctor," Dr. Westfield snaps. The nurse interjects. "Dr. Westfield, the patient's symptoms do warrant investigation per protocol." Dr. Westfield glares at her. "Nurse Chen, remember your place. Perhaps some basic tests would clarify things." "Perhaps you should stop telling me how to do my job," Dr. Westfield retorts. "Your kind always wants special treatment. The room temperature seems to drop." "My kind?" Michael asks quietly. Patients who think WebMD makes them experts, but his meaning hangs in the air, crystal clear. "Remove your shirt. No hospital gown offered. No privacy screen pulled." Dr. Westfield snaps on a single glove, though Michael noticed he wore two with previous patients. The cold stethoscope presses against Michael's bare chest without warning. The examination rushes by in seconds, perfunctory touches where there should be careful assessment. "Your heart rate seems unusually high," Dr. Westfield notes with theatrical concern. "Common in your demographic? Probably poor diet choices. I'm a vegetarian who runs 5 miles daily." Dr. Westfield snorts, ignoring this information entirely. "These symptoms are likely nothing," Dr. Westfield declares. "People like you tend to exaggerate pain." "I'd like blood work and perhaps an MRI," Michael requests calmly. Dr. Westfield scoffs. "Those tests are expensive. Your insurance might not cover them. My coverage is comprehensive. Take some painkillers and come back if it gets worse, though I doubt it will." "Doctor, I believe my symptoms warrant more thorough investigation," Michael insists, quiet. That's when Dr. Westfield snaps completely. His professional veneer shatters. Michael sits in his Tesla, hands perfectly steady despite the encounter. He pulls out his phone, not to call a lawyer, but someone addressed as director. "It's worse than we anticipated," Michael says, his voice now authoritative. Explicit bias, substandard care, hostile treatment. We have everything we need. Audio confirmed? Crystal clear. Plus a witness, the nurse. Excellent work, Davis. Submit your report tonight. We move tomorrow. Inside the hospital, Dr. Westfield watches from his window as Michael's car leaves. A satisfied smirk plays across his lips. Nurse Chen enters. Dr. Westfield, that was completely unprofessional. He'll get over it, Westfield dismisses. These people always play the victim. I need to report what I witnessed today, she states firmly. Report what exactly? Providing medical care. Be careful, Nurse Chen. Your evaluation is coming up. Who do you think administration will believe? A decorated physician or a nurse with barely 3 years' experience? Michael drives toward downtown, navigation showing an unmarked government building. He dictates notes with military precision. Subject exhibited clear racial bias. Refused standard diagnostic tests despite textbook symptoms. Made multiple discriminatory remarks. Nurse witness present, potentially cooperative. Michael's phone rings. The caller ID reads, Health Minister Williams. Investigation proceeding as expected. Dr. Westfield's behavior confirms all previous patient complaints. I have recordings and will submit my preliminary report tonight. After ending the call, Michael allows himself one moment of genuine emotion. Not just for me, he whispers. For everyone he's turned away. Dr. Westfield checks his next day's schedule and freezes. An unexpected meeting with the hospital board appears on his calendar. The next morning, Dr. Westfield's phone rings. The hospital director. Edward, did you review the patient? Complaints file I sent over? What complaints? Multiple discrimination allegations. The board meeting is to address them. Frivolous claims. Patients who don't get what they want always blame prejudice. This seems different. Please review before the meeting. Across town, Michael sits at a cafe opposite the hospital. Nurse Chen approaches his table nervously. I could lose my job for this. Or you could help change this hospital, Michael counters. He places his official identification card on the table. The gold emblem of the National Health Authority gleams. You're with the Health Authority? Chief Medical Inspector, Michael confirms. Dr. Westfield has 17 complaints filed against him in the past year alone, all from minority patients. Back at the hospital, Dr. Westfield discovers his computer access restricted. System says you're locked out, the IT technician explains. New protocol for doctors under review. Dr. Westfield storms to the director's office, finding a document on the desk. A formal investigation notice with Michael Davis's name and official title clearly visible. Chief Medical Inspector, National Health Authority. Dr. Westfield paces his office, phone pressed to his ear. James, I need your help. That patient yesterday, he's some big shot with the Health Authority. What exactly did you say to him, Edward? Nothing that can be proven. Were there witnesses? No one who will speak against me. You better hope so. These investigations can end careers. Meanwhile, Michael sits with the hospital director in a conference room. Evidence spread across the table. Audio recordings play from Michael's tablet. Not my patient. I don't treat your kind here. Dr. Westfield's voice unmistakable. The director winces visibly. This is just the latest in a pattern, Michael explains, presenting a thick file. 17 complaints in 12 months, all from minority patients. Dr. Westfield enters the boardroom, stopping short at the unusual assembly. Hospital attorneys flank the director. Board members sit stiffly. 2 empty chairs wait ominously. What's this about? Dr. Westfield demands. Please sit down, Edward. The boardroom door opens. Michael enters. Transformation complete. Gone is the patient in casual clothes. He now wears an impeccable suit, health authority credentials displayed prominently. Behind him follows the health minister herself. Dr. Westfield, Michael acknowledges calmly. Thank you for joining us. This is a setup. This is an official investigation, the health minister corrects. Nurse Chen enters with several other staff members. You can't believe these people over me. I've given 20 years to this hospital. These people, Michael repeats softly. Interesting choice of words, Doctor. Let me be perfectly clear about the scope of this investigation, Michael states. This isn't about one appointment. This represents 3 months of methodical investigation, dozens of interviews, and statistical analysis of every patient under Dr. Westfield's care for the past 5 years. Audio plays through the room's speakers. Not my patient. I don't treat your kind here. You recorded me without consent. The health authority has investigative privileges, the health minister notes. 2 years ago, my brother came to Dr. Westfield with symptoms similar to mine yesterday. He received no tests, no referrals, just painkillers. 3 months later, he was diagnosed with a brain tumor. Too late. That case led me to change careers, Michael continues, from corporate healthcare administration to the health authority's inspection division. Minority patients under Dr. Westfield's care experienced delayed diagnosis, fewer specialist referrals, and higher complication rates compared to white patients with identical symptoms and insurance coverage. The pattern is unmistakable and systemic. This is 17 formal complaints, 43 staff testimonies, and hundreds of patient files showing a clear pattern of discrimination. The full scope stuns everyone present. What Dr. Westfield thought was one unfortunate interaction was actually the culmination of a massive investigation. Breaking news fills the screen. Health authority uncovers alleged discrimination at prestigious Lakeview Medical Center. Dr. Westfield watches his professional reputation collapse in real time. The hospital director addresses the board. Our priority must be patient welfare and institutional integrity. We face 2 paths forward, the legal counsel explains. Contest these findings and face prolonged negative publicity, or cooperate fully and implement comprehensive reforms. My professional recommendation is unequivocal cooperation. The motion passes unanimously. Dr. Westfield is placed on immediate administrative leave pending a formal ethics hearing. This is a witch hunt. No, Michael responds. This is accountability. As Dr. Westfield clears out his office that afternoon, staff watch silently. 20 years, he mutters bitterly. 20 years of dedication, and you all turn on me in a day. No one turned on you, Nurse Chen says from the doorway. Your actions caught up with you. Michael meets with Health Minister Williams to discuss broader implications. Lakeview isn't unique, Michael explains. Similar patterns exist across at least 12 major hospitals in the metropolitan area. Then this becomes our test case for systematic reform. We'll need you to lead the expanded investigation. The medical ethics hearing convenes 1 week later. Dr. Westfield arrives flanked by expensive legal team provided by the National Medical Defense Association. Their strategy becomes apparent. Attack Michael's credibility rather than address the evidence. Mr. Davis lost his brother and blames my client, Westfield's attorney argues. This entire investigation is tainted by personal bias. What I found was a pattern affecting hundreds of patients, Michael responds. This stopped being personal when the statistical evidence became undeniable. Former patients testify. An elderly black woman describes waiting hours while white patients who arrived later were seen first. A Latino father recounts Dr. Westfield dismissing his daughter's severe abdominal pain only to have her appendix rupture hours later. Nurse Chen takes the stand. The pattern was consistent over 3 years. He'd spend 30 minutes with certain patients, 5 minutes with others. Race was the most consistent factor, not medical complexity, not age, not insurance status. When Dr. Westfield takes the stand, his arrogance resurfaces. Medicine requires judgment calls. Not everyone needs the same tests or treatments. And how do you determine who needs what? Medical factors, symptoms, medical history, risk profiles, such as race? I never said that. The data speaks for itself. When controlling for all variables except race, patients of color received significantly different care. A board member asks simply, if you could go back to that appointment with Mr. Davis, knowing who he was, would you have treated him differently? After a pause, Dr. Westfield answers, of course I would have been more thorough if I'd known he was with the health authority. He's just admitted standard of care depends on perceived importance, not medical need. The committee deliberates for less than an hour. Dr. Westfield's medical license is suspended for 2 years with reinstatement contingent upon completing extensive bias training. Additionally, all future practice must be supervised for 5 years following reinstatement. Months later, Michael stands at a podium in the National Press Club. What began with one case has revealed systemic issues requiring systematic solutions. Today, we're implementing new protocols across all federally funded healthcare facilities. Mandatory bias training for all medical personnel, anonymous patient feedback systems, statistical monitoring with publics, reporting, and a new patient's Bill of Rights. Equal care isn't special treatment. It's the minimum standard we should expect in a just society. At Harvard Medical School, students analyze the Westfield case. This landmark case fundamentally changed medical education. Implicit bias doesn't just hurt feelings, it costs lives. Medicine has always evolved. This is just the next evolution, removing bias from clinical judgment. Dr. Westfield sits in a small cubicle at a medical documentation company, the only work he could secure. On his computer screen, the press conference plays. His former hospital has become a national model for equitable care, while his career lies in ruins. Michael visits his brother's grave. "It's happening, Tony," he says quietly. "Real change, not just talk. Your death wasn't for nothing." Back at the health authority, Michael reviews data from implementation. Early results are encouraging, particularly in emergency departments where disparities were starkest. Healthcare discrimination didn't develop overnight, the health minister notes. We're facing centuries of entrenched assumptions. But for the first time, Michael responds, we have systems to measure it, address it, and prevent it. The final shot shows diverse medical students taking an oath, adding a new line. I will provide equal care to all patients, regardless of race, gender, or background, recognizing that justice is inseparable from healing. 1 year later, Michael sits in an examination room at Riverside Health Partners as a regular patient. His new physician, Dr. Anita Patel, reviews his history thoroughly. Your symptoms could indicate several possibilities. The previous medication helped partially, but we should investigate further. I'd like to run these tests to rule out the most concerning options first. Thank you for being so thorough. It's not thoroughness. It's standard care. Everyone deserves the same attention and consideration. Michael checks his phone. News headlines announce expanded healthcare equity regulations now covering private practices nationwide. Another notification confirms his appointment to the newly formed National Medical Ethics Commission. Meanwhile, Dr. Westfield completes his required bias training. You've met the technical requirements, the instructor says, but I'm not convinced you understand why your actions were harmful. Understanding discrimination isn't about checking boxes. It's about recognizing humanity in every patient. For a moment, genuine reflection crosses Westfield's face. Maybe I never really saw some of my patients. Not really. That's the beginning of understanding. Michael receives his test results. Dr. Patel explains he has a treatable condition that, left undiagnosed, could have caused serious complications. Exactly what happened to his brother. If my brother had received these same tests. I know, Dr. Patel nods. But because of your work, thousands of patients are now getting the care they deserve. As Michael leaves, he passes the newly installed patient rights display. A diverse group of patients reads the prominent statement translated into 12 languages. Outside, he calls the health minister with updates. Compliance is at 92% nationwide, and patient outcome disparities have decreased by 47%. The program is working better than projected. Equal care isn't special treatment. It's the only acceptable standard. Michael addresses graduating medical students at their white coat ceremony. Your generation has the opportunity to create a healthcare system where everyone receives equal treatment. The reforms we've implemented are just the beginning. The resistance we initially faced has largely dissipated as the data becomes undeniable. Even the most skeptical institutions have recognized that equitable care improves outcomes for everyone and reduces liability. Good medicine and justice align perfectly. A young doctor approaches. Dr. Davis, your case study changed how I view my responsibility as a physician. It transformed our curriculum. The real heroes are patients who spoke up before me and people like Nurse Chen who risked their careers to do what's right. The final shot shows Michael looking at his phone, a news alert about similar healthcare equity initiatives launching internationally. A closing voiceover delivers the moral. Justice in healthcare isn't just about punishing discrimination. It's about creating systems where equal care becomes the only acceptable standard. Change begins with one voice willing to speak truth. But it only succeeds when institutions embrace that truth and transform themselves.